The compounding facility's primary goal is to take care of specific patient needs.
Compounding is an art. It's the combination of art and science. The key is to get it right.
We do not utilize a cookie-cutter approach to provide a patient with efficient pharmaceutical outcomes.
What compounding has done is kind of brought us back a step. It's taken us back to when the pharmacist, who was trained to make medications, is actually working with a doctor to tailor a medication that is specific for that patient.
My name is Robert Anasharuk. I'm a licensed pharmacist. I'm the owner of Delco Drugs and Specialty Pharmacy, as well as the compounding facility. As a local pharmacist and as a member of the community, it is vital that I work with the physicians one-on-one, and I speak to them on the phone often regarding their patients and their patients' care.
My name is Al Franzone. I'm the Director of Sales at the compounding facility in Eltingville. I have found that being part here now of the compounding facility has been extremely rewarding because it gives you great satisfaction to be able to provide the services at this high level.
The compounding facility's primary goal is to take care of specific patient needs, such as allergies, intolerances, dosage forms, to really serve the community in an area that the large chain stores simply can't provide.
This is what compounding allows us to do. And it's cost effective in many cases, and it's more productive for the patient, and it's a better approach in terms of managing the patient.
The patient has to recognize, and we make sure that they do, that this is customized. It's like when you go in and get measured for a new suit. Okay, this is the same thing with this compound. It's customized to fit your particular needs, your specific needs.
Compounding requires a triad: the physician, the patient, and the pharmacist to all work together. So if we have a patient who may have a lactose intolerance or a lactose allergy, we can make their medication leaving out that ingredient. If a patient's allergic to dyes, we can make the medication leaving out the dyes.
For the children, we do plenty of things insofar as meeting those allergy concerns towards gluten, dye, casein, all right? And even just the fact that, children don't need to be getting more sugar today. We have sugar-free compounds that we put in place, always looking at the patient first. This is customized care.
If a patient can't swallow pills, we can make the medication into a liquid form. Patients who are on feeding tubes require liquids. Often they'll be crushing tablets that will clog the tubes. Some patients require suppositories. Other patients require topical creams. So all of these specific needs are addressed at our compounding facility.
In a way, everything old is new again. We're coming back to a place where we used to do it this way and then it got lost. But it's not something that's easy for the large chains to really do, because they're geared and set up in a certain way. They're geared to sort of to mass volume of getting out something that's already being delivered to them. And so that's why it's a niche for the pharmacist who takes that initiative to kind of create a model and a market to help restore that balance again.
Quite often as a patient, you've come to an impasse insofar as maybe being on a certain medication where either you're having problems tolerating it, you can't swallow it, you're incurring some side effects, or you become allergic to some part of the formulation. So as a patient, I would recommend that you first reach out to your healthcare provider. Mention to them that you're having these issues, you're having some problems, and the physician will look for an option in order to meet your needs, and that option would be to prescribe a compounded medication for you, and that's where the customization comes in.
Patients won't take their medications for various reasons. Sometimes they can't swallow pills. In that case, we can compound their medication into a liquid form, a suppository form, or a cream form. Some patients can't take their medication because of the lactose intolerance. Lactose is a common filler used in medications. We can make this medication in its purest form. Many children can't swallow pills. We'll make the medication into a suppository or a cream. Also, flavoring is a big issue. We use all natural flavoring agents. We use stevia-based. We try to really cut out the junk that's used.
I work a lot with patients who are in pain. And pain has many levels and many reasons why people persist in pain. But at the very least, with compounding, I've really been able to explore the use of more topical applications to help them manage their pain. I'm Dr. Jack D'Angelo, and I'm a specialist in physical medicine and rehabilitation.
Veterinary compounding is another area that we specialize in. We make fish emulsions for cats. We make topical preparations that can be applied behind a cat's ear. We make liver treats for dogs. We recently made one for a 75-pound pit bull. The dog treat was about the size of a baseball.
At the compounding facility, one of the key things for patients is the fact that they need to be educated insofar as the medication that was prescribed. So reach out to your physician. Then also check out our website, thecompoundingfacility.com, and you can see on our website that we have suggested compounds for disease states, maybe one that affects you.
So with compounding, if I have a patient who has a sensitivity to a certain medication or can't tolerate a certain medication because of perhaps gastrointestinal side effects, it allows me the opportunity to deliver it in a different way and perhaps help them with less side effects.
The unique thing about using compounded medication specifically for you is that the dose can be whatever it is you need and in the form that you need. I'm Dr. Janet Norton. I've been a physician for 30 years and now I am practicing anti-aging medicine.
Most of my patients are dealing with pain issues. I'm often locked into what's available to me. For many of those patients, they might have had a reaction to that oral preparation when they took it previously, and there hasn't been any other delivery system available. So I now have the opportunity to create topical solutions where I'm able to apply the same medication that previously they may have taken by mouth in order to provide them with some localized relief of the pain.
Now this is just a little device. In order to measure out when you have a cream, you need to measure how much cream. You just click and 1/4 of a cc is dispensed so that you don't have to worry about measuring or teaspoons or any of that sort of thing. And of course, it's measured for exactly how much medication you need. Maybe you need to use 2 clicks, maybe it's easier. And this is a fabulous cream that is just absorbed. You rub it in, and the skin surfaces depends on what it is that's in the cream and what it is that you need. So you rub it in and your body absorbs it straight away.
A prescription is sent over by a physician, usually via fax. We'll reach out to the patient to find out what specific needs they have, whether it's a dye allergy, a gluten allergy, medication that's not commercially available. Why exactly is the prescription being sent over to be compounded and not filled at our regular retail pharmacy?
We've created a state-of-the-art lab that deals with both sterile and non-sterile compounding, and again, just continuing to grow and move forward and avail ourselves to not only the patients but the physicians of the community.
We have a sterile clean room that is 797 sterile compliant. We have a non-sterile area which is 795 compliant. Both of these areas undergo rigorous testing to make sure that all our products are made in the most pure and safe manner. If you or your physician feel that a compounded product would benefit you, please check out our website, thecompoundingfacility.com. You or your physician can call us to discuss your options at 718-227-9800. Experience the precision of customized medications.